New at 6 tonight, a major debate about how often women should get mammograms. A national group of experts, the U.S. Preventative Services Task Force, just said women over 50 should get the test every other year. But many well-known organizations like the American Cancer Society, American College of Radiology, and Susan G. Komen say that's not enough. They recommend women 40 and over get them every year. Whether it's a mammogram, x-ray, CT scan, or PET scan, these tests can be life-saving.
But they also give off radiation that some believe can lead to cancer. Action 9 investigator Jason Stujanki found out the exact questions to ask before you agree to any scans.
But in 1994, this all began.
Sherry River is talking about her string of health issues. She says she's had a lot of medical imaging tests.
They just kept giving them to me.
Then she believes certain antibiotics made her more sick, and that meant more scans.
These are my CAT scans.
She started really keeping track of her CT scans and x-rays these last few years.
Do you think you've had too many? Do you think
Oh
you're going to
yeah,
have
I don't know what long-lasting effects I'm going to have.
That's why her husband was glad when his doctor did a 180.
He says no more CAT scans, no more x-rays unless there's a problem, because I don't want you to glow in the dark.
A recent Australian study claimed some increase in cancer risk is likely from current scans. Here in the U.S., the National Cancer Institute says each year CT scans could lead to 29,000 cancer cases in the future. But it also says the benefits far outweigh the risk.
Really important.
Dr. Don Frush told me the same thing. He's a Duke radiologist. He's also involved with the National Medical Imaging Awareness Group, Image Gently.
If every scan is useful in managing that patient, then it doesn't matter whether there's 1 or 10 or say 20 x-rays, because they're all very important.
That said, still ask questions. If it were Frush, he'd ask his doctor, what are the risks? Is there another test that uses less radiation and is just as effective? Can you use less radiation for a person my size? And finally, can you use less radiation for what you're looking for? And these questions are becoming increasingly relevant. More doctors are starting to recommend routine CT scans for lung cancer screening. And come July 1st, the American College of Radiology is requiring all hospitals to keep track of how much radiation patients get if they want to keep a certain accreditation. Patients like the Rivers. In Waxhaw, Jason Stujanki, Channel 9 Eyewitness News.
Consumer Reports recently laid out exactly when you might need one of these tests. It included preventative screenings as well as conditions such as extreme headaches, head injuries, and back or stomach pain.